This presentation is brought to you by Brain Core Therapy. Post-traumatic stress disorder, also known as PTSD, is not a new phenomenon. It has been known throughout the years by a variety of different names. PTSD is one of the signature mental illnesses of the 21st century. This is largely due to the number of veterans returning from the wars in Iraq and Afghanistan who are haunted by the trauma they experienced while fighting. However, the history of PTSD extends much further back than 2002. This marks the year that America went to war in Iraq. PTSD affects many people, not just war veterans, but also those who have been through any traumatic experience such as abuse or natural disaster. In fact, it's been studied by medicine for hundreds of years now. From 1678 to 1799, a disorder known as nostalgia is identified by Swiss physicians. Later, a doctor named Dominique Jean Larrey would be the first to codify 3 stages of symptoms. Modern historians now identify nostalgia as the first record in history of PTSD. In 1855, the Government Hospital for the Insane is established in the United States, and Americans with symptoms of PTSD are treated for the first time. From 1861 through 1865, military doctors serving patients in the Civil War archived the first military medical documentation concerning the stressors experienced by soldiers. In 1905, the Russian Army recognizes and begins to treat battle shock in their combat veterans. In 1919, after World War I, the medical community coins a term for PTSD known as shell shock. In the same year, famed psychologist Sigmund Freud writes a foreword for a book which was written by a colleague about a disorder called war neurosis. Freud maintained an interest in PTSD for some time afterwards. From 1939 to 1945, in World War II, the U.S. Army realizes that combat exhaustion has become a major problem and adopts a policy stating every man has its breaking point. They begin developing a treatment plan for this disorder. From 1952 to 1968, the medical community becomes increasingly aware of the devastating effects of acute stress. The Army begins providing officers to help with psychological problems afflicting soldiers in the Vietnam War. In 1972, a writer named James Chatham recognizes post-Vietnam syndrome in many combat veterans and writes about it in the New York Times. In 1980, the first record in history when PTSD is called by its current title. This is the year it appeared in the DSM, the Bible of Psychiatric Diagnosis. From 1987 to present, PTSD has become better understood by the public at large due to media exposure, scholarly research on the disorder, and the return of veterans from the first Gulf War and the wars in Iraq and Afghanistan. You can see that PTSD is intimately bound up with the stressors of war, although psychologists have now discovered that a person does not need to have been through combat to suffer from the affliction. If you or someone you know is suffering from PTSD, please seek medical attention right away. For more information or to schedule a consultation with your local Brain Core clinic, please visit our website at www.braincoretherapy.com.